Hello, everyone! Today we're going to be looking through an Indigenous lens at how historical events have impacted the physical and emotional health of AIAN people. We will learn how to describe an overview of AIAN history as a continuum from pre-contact to the present, identify, acknowledge, and analyze one's own emotional reactions to this history, and offer opinions respectfully, and explain the connection between history and present health outcomes, including the forms and impacts of racism. American Indian and Alaskan Native history, before European contact, was marked by diverse cultures thriving across North America with complex social structures, sophisticated economies based on hunting, fishing, and agriculture, and deep spiritual connections to their land. Notice some key points in the continuum. We will start with pre-contact era. Diverse tribes across North America with distinct languages, cultures, and economies adapted to their unique environments. Complex social structures with leadership roles, kinship systems, and spiritual beliefs deeply intertwined with nature. Subsistence practices including hunting, fishing, gathering, and agriculture depending on region. Upon European arrival, colonization led to devastating population declines due to disease, forced displacement, and violent conflict. Introduction of European diseases, like smallpox, caused devastating population decline among native communities. Initial trade interactions with European settlers often led to conflict and land disputes. There was also displacement of native populations as European settlement expanded westward. The colonial era in Native American history was marked by dramatic demographic decline due to forced displacement from their land, complex relationships with European colonists, including both alliances and warfare, disruption of traditional economies and social structures, and a struggle to maintain cultural identity amidst increasing European influence and encroachment on their territories. Indian Removal Act of 1830, forcing tribes to relocate to reservations west of the Mississippi River, including the infamous Trail of Tears. Wars and treaties occurred between European powers and native tribes, often resulting in forced removal from ancestral lands. Assimilation policies aimed at eroding native cultures through boarding schools prohibited traditional languages and practices. The colonial era impacted different Native American groups differently depending on their geographic location, cultural practices, and interactions with European powers. Despite the hardships, many Native American communities demonstrated resilience and adaptation in the face of colonization. The relationship between Native Americans and European colonists was not solely antagonistic, with instances of cooperation and cultural exchange occurring in certain situations. The reservation era was characterized by the forced relocation of tribes onto designated reservations, often far from their ancestral lands, where they faced severe restrictions on their traditional way of life, including limitations on hunting, fishing, and cultural practices, coupled with attempts at assimilation through policies like boarding schools, food rations, and the suppression of their languages, leading to widespread poverty and cultural disruption on reservations. This period was marked by significant loss of land and autonomy for Native American tribes due to government policies aimed at controlling and civilizing them. The reservation era, or the establishment of reservation system, was often on marginal lands with limited economic opportunities. There was federal government control over tribal affairs, including land management and governance, and continued cultural erosion and challenges related to poverty and social issues. What were the assimilation efforts? Policies like boarding schools aimed to assimilate Native children into white culture by forcing them to abandon their languages, traditions, and religious practices. There was also dependency on rations. Many tribes became reliant on government-issued food rations, which often were inadequate and contributed to malnutrition. There was also loss of traditional economy. The transition from nomadic hunting and gathering to reservation life disrupted traditional economies, making it difficult for tribes to sustain themselves. They also had social and health issues. Overcrowding on reservations and poor living conditions contributed to the spread of disease and high rates of poverty. The 20th century and beyond in Native American history was marked by a complex mix of continued assimilation policies, growing resistance movements advocating for tribal sovereignty, cultural revitalization efforts, and a push for economic development and political self-determination, with a significant focus on reclaiming languages and traditions, often through activism and legal challenges against the U.S. government. During the 20th century and beyond, we see rise of Native activism and political movements advocating for self-determination and tribal sovereignty. The Indian Self-Determination and Education Assistance Act of 1975 granted greater tribal control over education and programs. There was a growing recognition of Native cultural heritage and efforts to revitalize languages and traditions. There were ongoing struggles regarding land rights, treaty violations, and economic disparities. Key characteristics include assimilation policies. The early 20th century saw the continuation of policies like the Dawes Act, which aimed to assimilate Native Americans into mainstream society by breaking up reservations and forcing them to adopt individual land ownership, often leading to significant loss of tribal lands and cultural practices. Boarding schools. The boarding school system, designed to assimilate Native children by removing them from their communities and forcing them to abandon their languages and traditions, was prevalent throughout the early 20th century, causing immense cultural disruption. Economic development initiatives. Native communities sought economic opportunities through tribal enterprises, casinos, and tourism development on reservations, while also facing challenges related to poverty and unemployment. Legal battles. Native American tribes engaged in numerous legal battles to protect their land rights, treaty rights, and cultural practices, and increased visibility and representation. The late 20th and early 21st centuries saw a growing recognition and visibility of Native American cultures and perspectives in mainstream society, including through media representation and academic studies. Some important considerations are diversity within Native communities. The experiences of Native peoples vary greatly depending on tribe, region, and historical interactions with settlers. Resilience and adaptation. Despite facing significant challenges, Native communities have demonstrated resilience by maintaining cultural practices and advocating for their rights. And contemporary issues. Today, Native communities continue to grapple with issues like poverty, healthcare disparities, and access to quality education. Discovering the context of North American history on Indigenous culture is often eye-opening and shocking for non-Native individuals. The real history and experience of Native American and Alaskan Native people deserve attention. The truth of Native history needs to stand out in its full dignity, resilience, and living relevance. A deeper understanding of accurate history leads to compassion for current situations and issues. It's important to educate yourself on historical trauma to understand why that trauma continues to fulminate on reservations and in Native communities. Be aware of the tribe's decision-making process and meeting protocols related to prayer, food, and gift-giving, and be prepared to act accordingly. Develop cultural knowledge of the particular community served and access cultural brokers who may have that knowledge. Tune in to socio-cultural factors such as tribal affiliation, language, gender roles, education, socioeconomic status, values, community, family, sexuality, social organization, e.g. matrilineal, geographic location, etc. Understand that being Native means different things to every person. To some people, it means being Indian. To some, it means being Native. To some, it means being American Indian, Native American, Indigenous, Alaska Native, First Nations. Some folks exclusively use their tribe's name. Avoid the instinct to characterize Indigenous communities as despairing, impoverished, and hopeless. Work to understand the connection between historical and intergenerational trauma and the health disparities that disproportionately impact Indigenous people and are rooted in Indigenous experiences of disenfranchisement, displacement, genocide, discrimination, resulting poverty, and intergenerational trauma over centuries of American colonization. Build rapport. When making introductions, Indigenous people often share stories and information that connects them to land, tribe, ancestors, and relations. To build trust, share similar stories about yourself, such as where you consider to be your homeland or something about your family. The appropriate use of humor can also be an effective way to build rapport. AIAN, people communicate a great deal through nonverbal gestures. Careful observation is necessary to avoid misinterpretation of nonverbal behavior. Be empathic and vulnerable. Share your own stories, history, and experience when appropriate, and convey understanding and compassion for the concerns and apprehensions expressed by Indigenous people. When working with tribes, it is helpful to understand how Indigenous values may differ from the values dominant in non-Native American culture. This offers greater insight into how to communicate effectively. Respect the importance of traditional healing practices. Indigenous healing incorporates spirituality and is holistic in nature, with a focus on the perceived cause of illness rather than just the symptoms. Many Indigenous people utilize a combination of Western medicine and traditional healing. The role of a healer in Native culture is highly respected. The concept of tribal sovereignty refers to the authority tribes have to govern themselves. This authority allows tribes to create a government, determine their own membership, and manage tribal lands and businesses. Each tribe has some form of government which provides services, has sources of revenue, passes laws, and enforces laws. These governments each have a tribal jurisdictional area, which is considered federal land, where state laws do not always apply. Elders play a significant role in tribal communities. The experience and wisdom they have gained throughout their lifetime, along with their historical knowledge of the community, are considered valuable in decision-making processes. It is customary in many tribal communities to show respect by allowing elders to speak first, not interrupting, and allowing time for opinions and thoughts to be expressed. Recognizing and identifying strengths in the community can provide insight for possible interventions. Since each community is unique, look to the community itself for its own identified strengths, such as extended family and kinship ties, long-term natural support systems, shared sense of collective community responsibility, physical resources, for example, food, plants, animals, water, land, indigenous generational knowledge or wisdom, survival skills and resiliency in the face of multiple challenges, retention and reclamation of traditional language and cultural practices, ability to walk in two worlds, mainstream culture and the AIAN cultures, and community pride. The historical trauma experienced by American Indian and Alaskan Native communities due to colonization, including forced relocation, cultural destruction, and boarding schools, has a direct and significant impact on their present health outcomes, with ongoing racism contributing to disparities in access to healthcare and overall well-being, leading to poorer health compared to the general population. This is often referred to as historical trauma, which can manifest in various forms, including mental health issues, chronic diseases, and lower life expectancy. Colonial policies and violence, historical events like forced removal from ancestral lands, annihilation, and the assimilation policies of boarding schools caused widespread trauma and disruption of traditional ways of life, leading to long-term negative impacts on health and social structures. One of the most tragic effects has been the onset of lateral violence, which happens when long-oppressed groups feel so powerless that rather than fighting back against their oppressor, they unleash their fear, anger, and frustration against their own community members. Dispossession of land and resources. The loss of land and access to traditional food sources contributed to poverty and food insecurity, further impacting health outcomes. Cultural disruption. The forced suppression of languages and cultural practices led to a loss of identity and community cohesion, impacting mental health and overall well-being. Systemic racism in healthcare. Ongoing discrimination in the healthcare system, including lack of culturally competent care, limited access to healthcare facilities in remote areas, and mistrust of medical providers due to historical abuse, creates barriers to quality healthcare. Several different types of racism have had a significant effect on health within American Indian and Alaska Native communities. Implicit bias, unconscious biases held by healthcare providers can lead to poorer quality care for Native patients. Discrimination in healthcare systems, unequal allocation of resources and funding to Native health facilities leading to inadequate care. Lack of cultural competency. Healthcare providers may not understand cultural practices and beliefs, leading to miscommunication and mistrust. Environmental racism, placement of hazardous waste sites or industrial facilities on or near Native reservations, disproportionately impacting their health. Systemic racism has affected American Indian and Alaska Native tribal communities in multiple ways. Higher rates of chronic diseases. Native Americans experience higher rates of chronic diseases like diabetes, heart disease, and cancer due to factors like poor diet, lack of access to preventative care, and stress from systemic racism. Mental health disparities. High rates of depression, anxiety, and suicide are often linked to historical trauma and ongoing discrimination. Lower life expectancy. Compared to other racial groups, Native Americans have a significantly lower life expectancy. Maternal and infant mortality disparities. Native American women experience higher rates of pregnancy complications and infant mortality. To address historical trauma in American Indian and Alaskan Native communities and improve health outcomes, it's crucial to prioritize culturally sensitive approaches that focus on reconnecting individuals to their heritage, fostering community healing, and providing access to culturally appropriate healthcare services, including incorporating traditional healing practices while actively engaging with tribal leaders and communities to develop tailored interventions that respect their unique needs and experiences. Key strategies include culturally competent healthcare providers, train healthcare professionals to understand the impacts of historical trauma, incorporate cultural knowledge into their practice, and build trust with Native patients by respecting their traditions and beliefs. Community-based interventions. Develop programs led by tribal members and community leaders that utilize traditional healing practices like ceremonies, storytelling, and land-based activities to promote healing and resilience. Integration of traditional healing practices. Incorporate traditional healing modalities like herbal remedies, sweat lodges, and spiritual practices alongside Western medicine, allowing individuals to choose approaches that align with their cultural values. And addressing intergenerational trauma. Recognize how historical trauma can be passed down through generations and provide support to families and children impacted by these experiences. When addressing the issue of historical trauma, some strategies to deploy are trauma-informed care. Implement trauma-informed practices in all healthcare settings, including understanding the triggers of trauma and creating a safe space for individuals to share their experiences. Collaboration with tribal governments. Partner with tribal leaders and organizations to ensure interventions are aligned with community needs and priorities, respecting tribal sovereignty and decision-making processes. Mental health awareness and access. Increase access to culturally appropriate mental health services, including culturally competent therapists and specialized programs designed to address the unique needs of Native communities. And addressing social determinants of health. Work to address systemic issues that contribute to health disparities like poverty, lack of access to quality housing, and educational inequalities. Notice more strategies to deploy. Respectful language. Use culturally appropriate terminology and avoid stereotypes when discussing historical trauma and Native communities. Community engagement. Actively involve community members in the design, implementation, and evaluation of interventions to ensure relevance and effectiveness. Cultural sensitivity training. Provide ongoing cultural sensitivity training for healthcare providers and other professionals working with Native communities. Data collection and analysis. Utilize culturally appropriate research methods to accurately understand the needs and experiences of Native populations. By implementing these strategies, healthcare providers and community leaders can work together to address the lasting effects of historical trauma on American Indian and Alaskan Native communities and promote improved health outcomes for individuals and generations to come. Educating providers about the history of American Indian and Alaskan Native oppression and its impact on mental health is crucial. It allows for better understanding of the cultural context of patients, leading to more culturally sensitive and effective healthcare delivery, particularly when considering the historical trauma, unique health disparities, and traditional healing practices prevalent within these communities, ultimately improving patient care and trust. Some key reasons are cultural understanding. Understanding cultural beliefs, values, and practices, including the role of spirituality and community, can greatly impact how patients perceive and engage with healthcare. Building trust. When physicians demonstrate understanding of a patient's cultural background, it can foster trust and open communication, leading to better treatment adherence. Traditional healing practices. Recognizing and respecting traditional healing practices alongside Western medicine can allow for a more holistic approach to patient care. Informed decision-making, knowledge of the unique health concerns within Native communities, like higher rates of diabetes or certain cancers, allows physicians to make more informed treatment decisions. And advocacy for change. Educated physicians can become advocates for policies and healthcare systems that better address the needs of American Indian and Alaska Native populations. Here are our resources. Thank you for listening to this presentation.